Welcome to Accelerate My Practice. I wanted to chat about a phone call I got, which is one I don't know that I've ever gotten before. And it was an interesting conundrum that I think is probably worth repeating to others. The question I got was, we're getting too many new patients. For those of you who don't have that problem, we should maybe have a marketing conversation, but kudos to this office for too many new patients, to the tune of about 60 new patients a month, which, of course, depending on the size of your practice, that might be a silly statement. But if you're a solo doctor with, 2 full-time hygienists, 60 new patients a month at an hour an exam, if you will, is a lot of time to be burned, and it was cutting into productive time a lot. So my first thought around this was to say, hey, maybe we should go out of network with some insurances. And then I was brainstorming with the rest of my team, and Barb Maddie had a wonderful question or thought, which was, maybe before we do that, we should get better at screening the patients, which was part of the conversation I had with that office. But I wanted to dig into that a bit more because I think there was some real brilliance in what she was suggesting. And the brilliance is that if we can screen the patients, meaning as we're on the phone with them, talking to them, and on that initial phone call, and we're expressing and sharing with them our philosophy of our practice, how we operate, what we are, what we stand for, the odds are some percentage of them who maybe don't agree with that might not come in as a new patient. Here's my point. If when we're on the phone with them, we say, hey, so great to hear from you. First off, tell me why you're looking for a new dental office. Because that's really important, right? Are they leaving the other office because the other office offered comprehensive care and wanted to do perio treatment because the patient's a perio patient and they said no? If that's the case, we should save ourselves the time. So we should always ask why they're leaving their other office, or how long it's been, of course, since they left their other office. And then ensuing some dialogue through there, I would want to share my practice philosophy. I'm going to just make up an illustration here, so you'll have to change it to fit yours. But the illustration could be something along the lines of, hey, we're a very health-centered practice. And what we mean by that is that we offer comprehensive care, meaning we want to fix the causes of problems as well as the problems. And the differentiation there, of course, is that some practices just fix broken teeth, but we're not fixing the cause of the broken teeth. Could be a bite issue, could be a perio issue, could be all kinds of stuff. But our practice, we want to offer comprehensive care, meaning we're going to really come at you with the full solution for everything you need to have ideal, optimal health. And that's important for you to know this, because I don't want you to come in here and think that we're trying to oversell some things. We don't believe in that at all. In fact, we're kind of the contrast to that. We have found that by being comprehensive, we save our patients a lot of money over time because they don't have to come back repetitively for things continuing to fail. So our philosophy is to be very, very comprehensive. Now, some people might find that overwhelming. I don't know where you're at on that spectrum, but I want to be very transparent with you so you as a patient can decide if we are a good fit for you. This is important because dentistry impacts your entire body, and your entire body is impacted by dentistry, both directions. I'm not sure if I said that super clearly, but there's a huge connection to your overall health from your mouth. Greatest example as of late, COVID. If your body is fighting an infection because you have periodontal disease or some sort of an infection in your mouth, your body is using some percentage of its resources that it could otherwise use to fight and prevent you from getting sick with COVID. In fact, there's been studies done. I don't know that I can cite them well enough to repeat them, but there was a study I read about that was done in England, I think it was, where they had patients who were about to go on ventilators, and for whatever reason, the course of action they took was to do a bunch of perio treatment on the patient, and the patient's health dramatically changed. Google search it, fact check it, don't take it at my word, because it's not like I'm sitting here reading it right now. I read it about a month ago, but nonetheless, there's a huge correlation there. And there's similarly correlations between oral health and oral cancer. Some of the same cancers that cause oral cancers cause cervical cancers. Do our patients know this? When we're taking that new patient phone call, are we merely just scheduling them and dropping them in the schedule with no thought about whether or not they're a good fit? Or are we having some sort of dialogue as illustrated here, whether this is the exact right one or not is sort of inconsequential, but are we having a conversation with them to help them be discerning about whether or not they're a good fit. You know, I had another office that had this patient that was coming in, and constantly this patient was always like, I'm in a hurry, I'm in a hurry, I'm in a hurry. He would show up late, and then he'd be upset at the office when they weren't done on time because he showed up a half hour late. Great patient to not even schedule in the first place. Now, would a dialogue like this have revealed us? I don't know, of course. But what my point is when we are getting 60 new patient phone calls, instead of just shutting off the faucet, what we should maybe do is be more discerning through interviewing the patient so they decide they want to be at this practice in lieu of what our philosophy is, and we end up with amazing patients. So maybe instead of going out of network, we should just be more discerning. Now here's the real key. One, we need to train whoever's on the phone and taking these phone calls how to have these conversations. Two, we need to be super consistent about these conversations so that every time the phone rings and it's some new patient, we get into this rhythm of having this conversation to almost talk some percentage of the people out of coming to the practice because we know they're just not going to be a good fit. And if we do that, what I think we'll have amazing new patient flow and patients who are accepting treatment and really setting the stage that this is how we function. So when they do come in and they're presented with a comprehensive plan, they're not shocked. They're not surprised. And in fact, they're welcoming it and looking forward to it because their other office didn't offer it. And you set the expectation up front that this is what we do. My guess is if we do this, maybe our 60 new patients drops to 40, but the 40 are really high quality. And we just saved ourselves 20 hours of work with people who aren't going to accept treatment, maybe show up late and argue about everything and are just a pain in the caboose. So as I thought more about that, and debated it with my team, I really wanted to come back and film this because, like I said, I don't usually get this question at all. And it was a really great question that I thought was worth digging into some. And of course, I wanted to get this resource to this office as well. But there might be others of you out there with the same issue. That being said, if there are ever times where you're running into topics that you're just not sure how to solve, man, shoot us an email at info@acceleratemypractice.com, and we'll gladly research it and film it just like this. And it gives you an opportunity to get a custom answer to your issue, because likely someone else has the same question as well. So appreciate your time and attention here. Shoot us an email if you like what you're hearing. Post us a comment if you like what you're hearing. If you don't like what you're hearing, don't post us a comment. And then if you want more topics, email them on over and we'll gladly shoot them for you. Otherwise, thank you so much. Have a wonderful day.